Well, I'm very, very sorry about that. I don't know what happened, but all of a sudden we lost connection. So I'll just kind of peruse through and go through. Hope we haven't lost too many people. Again, this is Dr. Ken Muich, Fibromyalgia Wellness Center. We're going to be talking about some very interesting subjects today. First one being marijuana, and in a medical sense, not in a recreational sense. In 1974, there was a study done, believe it or not. In 1974, there was a study done concerning pain and how it might be able to relieve pain in those patients that had spinal cord injuries, primarily males. And they found it worked quite well. The stronger the dose of the THC, the better. At that point, they were actually having fibromyalgia patients use marijuana through smoking. And they found, however, that it had to have a larger dose because of the uninhaled smoke that did not go through their system. And so consequently, that's what they had. That's all they had at that time was marijuana through cigarette smoking. But it did work, and it did work to relieve pain. There was another study that was completed in 2014, and it was an actually 11-year study, believe it or not, and it was very, very interesting. It was a comparison to those states that either allowed medical marijuana or that actually had not only allowed it, but also had it as recreational. And they found that those states that allowed medical marijuana or recreational marijuana had a much lower opioid overdose death level than those states, like I say, that that did not have any marijuana medication. So opioid deaths, whether it be prescription or by opioid itself, were a lot lower in those states that allowed marijuana. Believe it or not, that's fascinating. So why is it just a Schedule 1 drug versus any other schedule? Schedule 1 actually says that there's no acceptable medical usage for marijuana, which is ridiculous because all the tests that have run thus far does have a successful relief of pain in one form or another, and especially in a lot of different conditions, which we're not going to really cover all of those at this time. There's studies on everything from diabetes to lupus to a variety of other things that allow. As a matter of fact, they did studies on the relief of neuropathy as far as the feet is concerned, and marijuana seemed to help that also. But a good example, now we use a protocol, of course, that cannot use salicylates, and of course marijuana is a salicylate. It's a plant-based. And so that adversely affects the guaifenesin protocol. It blocks the guaifenesin from working, as I've mentioned in the past. So I had a patient come in, and he was in his late 50s. He had fibromyalgia, never been treated before. We started the protocol. And because of some other secondary conditions that he had at his age, he actually got a marijuana license for usage. And he came in and he said, "Can I use it?" And I called Dr. St. Amman and asked if there were any tests done, because obviously it's a plant, and he said they were in the process of working on that to see whether or not marijuana actually had any adverse effect on their protocol. So what I told the patient was, yeah, just use it. I said, try it and we'll see what happens. You'll be a test case. He was okay for about 2 weeks, and then after 2 weeks, I noticed that because he was right in the middle of his protocol and he was doing quite well. But after about 2 weeks, he started plateauing, and then by the end of the month, he started getting worse as far as his symptoms are concerned. So I told him, I said, well, really would not help with you staying on this. You maybe try something else. And yet, because it was helping his other secondary conditions, he decided to stay on, and so he left our program. There's nothing I could do, obviously, in that relationship. But at least in this case, if you're on our protocol, that marijuana may not be a help, it can be a hindrance. However, when you have a pain that is insistent and persistent, and it can be to the point where your normal activities of daily living are affected, I believe, and also Dr. Saint Amand, who I work with in California, believes that whatever medication that you can take to alleviate some of that pain should be taken, even on a temporary basis, to help you get back to somewhat of a pain relief status. But to stay on it would not be advantageous, and obviously would be something that would adversely affect your protocol. So marijuana in this case, if you really know it's going to help, whether it be for your headaches or sort of joint pain or whatever it might be, back pain, marijuana would be a wonderful temporary way which would be allowable as far as our protocol is concerned. We try to help and work with this patient and see if we could work our way through with him, as I had mentioned. But his persistence in using it was, he reached a level where he was plateauing and it wasn't getting any better. And so I left it up to him as far as what he needed to do. But I thought I would bring that to your attention. Marijuana does work to relieve pain in many, many cases. If it's not smoking, because I have a lot of patients, I'm not going to smoke. I've never smoked in my life. Well, they do have jellies and a variety of different candies and so forth that you can take, and you can actually use and see what amount that would be best for you and your pain level. Speaking of pain, when is pain not fibromyalgia pain? This is very, very interesting. Fibromyalgia patients come in. A lot of patients come in, they have a number of different areas and pains. As I mentioned before, there is no, let's put it this way, since 1990, there is no fibromyalgia patient that just has fibromyalgia. We have found that every patient that comes in that has fibromyalgia has other conditions, or at least a condition that fibromyalgia makes worse. And so sometimes these are made worse in helping diagnose, because we have to differentiate what is fibromyalgia pain from non-fibromyalgia pain. So what we ask the patient to do, and I mentioned to you, we spend a good 45 minutes to an hour with each fibromyalgia patient to find out exactly what their conditions are. What other diagnostic conditions have you been specifically diagnosed with? Not something you got out of a magazine or whatever else that might not be worthwhile. It's something that a professional health condition that has been diagnosed in one form or another. Now, allopaths have a difficult time, as I mentioned, with fibromyalgia patients, because they come in with so many different symptoms, and it takes time to differentiate those. And so, again, allopaths, MDs, DOs use their form of diagnosis by way of objective testing. That's x-rays, blood tests, urine specimens, so forth and so on. And then they get the results, and then they actually put together a diagnosis. And so that's how they diagnose you. However, fibromyalgia patients, as I mentioned, all of these come up negative, except for other conditions that you have. And so it's very, very difficult for them to diagnose, and that's why patients go from doctor to doctor and different places, and they get different medications and so forth. So first thing is understanding that fibromyalgia patients have other conditions, and fibromyalgia makes them worse. So you have to write down what all your symptoms are. What are your symptoms? Could it be ankle pain? It could be, headaches. It could be shoulder pain. It could be stomach pain. It could be something that I haven't mentioned, hair loss, a variety of different things. Write all your symptoms down. That's very, very important, because we have to help differentiate this. What are your other diagnoses? As I mentioned, you have to write those down that have been definitely diagnosed as such. And then take all the medications that you have, and look up on Google or someplace, medical book, and find out what the side effects are. What are all the side effects of these medications? And then match those side effects with the symptoms that you have, because some of these symptoms that you have are not from conditions. They might be from the medications that you're taking. And so we take all of these things, we put them all together, we look at them, and when we sit down with the patient, we say, okay, these are the conditions that you have. These are the symptoms that relate to them. The fibromyalgia patients have pain, aching pain all over their body. It takes at least 3 months of continuous pain, but it's not in a specific area. The fibromyalgia patients were put under rheumatological conditions just because they couldn't fit them anywhere else, because fibromyalgia is not a bone destructive condition like the vast majority of rheumatological conditions are. I want to mention something to you. There is one really important rheumatological condition that mimics fibromyalgia, but in an unusual way. It is non-destructive, and it's very, very interesting. It's called polymyalgia rheumatica. Polymyalgia rheumatica. And in my 30-plus years, I've come across maybe 6 people that have had this, but maybe even more so with, even though it's only about 6, I find quite much more common in fibromyalgia patients. It involves pain in either both shoulders or both hips or both knees. Both shoulders, both hips, both knees. But if you had x-rays or MRI, there's no destruction in those joints. It's a very unusual rheumatological condition, and it's very easily taken care of under a short dose of prednisone. Now, I'm not crazy about medications, but prednisone works like a charm for patients that have this condition, and you only have to use it for a short period of time. Matter of fact, maybe only 1 or 2 doses, and you feel maybe 75–80% better. And you only have to take the prednisone while these symptoms actually occur. It may disappear, come back in a couple of years, take another dose a little bit, bingo, and then you're off it again. So that's something for you to consider. So the most important thing is differentiating fibromyalgia pain from other conditions, or maybe from medications that you're taking that actually have nothing to do with your condition, which we have found in many, many cases. Now, this takes time, and that's why the next question kind of folds into this, when doctors really won't listen to you. Look, they don't have time. They have a certain period of time they can work with each patient. Fibromyalgia patients take time. Fibromyalgia patients have a lot of symptoms. They have a lot of concerns and so forth about how they can be helped. And most MDs, DOs, usually you end up with a physician's assistant, PA, who probably knows a lot less than even the doctors about fibromyalgia. And so you have to understand that when you're dealing with a doctor like this, you have to bring in a lot of information to help them. You, again, have to write down all your symptoms, all your pre-existing diagnoses that you've had. Also fibromyalgia, the medications that you're taking, and also the side effects. Look, there's a lot of different medications out there, and you don't have to take the ones that they're offering you, especially if most of their side effects, I hate to use the word, but Lyrica has a lot of side effects that are the same as symptoms of fibromyalgia. You don't have to take Lyrica. There are other medications that maybe are less symptomatic for fibromyalgia patients. So ask them for other medications, and look and ask them if they have any background in fibromyalgia. Have you worked with fibromyalgia patients successfully? Okay, and I'd like to speak to those patients if you don't mind. They should be able to suggest to you, offer to you, like we do. Fibromyalgia patients that are going through the protocol or have gone through the protocol, we have them constantly in contact with existing new fibromyalgia patients. They don't mind because they're getting better. They want other people to know what they're doing, how they're being successful at this. You have to take it upon yourself to manage your care. You can't expect a doctor, especially on a fibromyalgia patient, to deal with this. I find that it would be extremely difficult for a doctor to spend quality time with a fibromyalgia patient and still see all of his patients properly, unless he really is sincere about dealing with fibromyalgia patients. And I find that allopaths, MDs, DOs, most of them have a difficult time still accepting fibromyalgia as a condition. And so take that upon yourself. Now, I have, and Dr. St. Amman have lists of doctors throughout the United States that have been trained in the fibromyalgia protocol. So if you're not happy with someone that you're working with, if you're local, we're more than welcome to help you. If you're out of state and you're getting this information, contact us, let us know. We'll try to find someone in your area, which I've done a number of times just recently, as a matter of fact. So make sure you keep that in mind. So marijuana, you've got some pain, so forth and so on. The use of marijuana oftentimes is helpful in pain relief and in many other conditions. As far as differentiating fibromyalgia from other conditions, just follow what I said. Make sure you write down the symptoms, write down the diagnosis that you have, look up the side effects of your medications. And as far as when the doctor won't listen to you, fibromyalgia patients, you're not crazy. You don't need to go to psychiatrist or psychologist. It's not in your head. It's in your body. We can help you with that. Don't be stuck just with one doctor. Insanity is doing the same thing over and over again. If you're taking medications that aren't helping you, they're probably adding on to your symptoms, especially if you haven't looked up the side effects. So make sure you do that. By the way, there was a question that came out, and I apologize, from at least on her email. It's Misty Rose, and it had to do with the salicylates. And the information I was giving you on salicylates had to do with those people that are on our protocol, the guaifenesin protocol. Guaifenesin pulls the excess phosphate and calcium out of your cells, and you urinate it out. However, salicylates, which are plant-based, everything plant-based, will block that. You can eat whatever you want to that's plant-based. You can eat the lettuces and celeries and so forth and so on, because there's enzymes in the livers that break that down. It's those things that are considered either cosmetics that you rub on your skin, because the salicylates are easily absorbed through skin and intestine, or supplements. And supplements are things like teas, and a lot of supplements like vitamins, rose hips, so forth and so on. All those things that you may be ingesting. Look at a bottle. If it says supplement, you can't take it. If it's plant-based, turn the bottle around, look and see what is in the product. If you find out what's in the product and it has a plant on it, then it's going to block the protocol. That's the key behind it. Okay? So hopefully I helped differentiate, because Misty Rose wanted to have the information. I did send her an extensive text on this. Hopefully I explained it detailed. Don't be afraid to ask questions. I try to get to them as quickly as I can between my clinic work and answering questions, so forth. I do everything I can to get back in touch with you as quickly as I can. And again, this weekend has been very, very exciting and hectic because of the children, grandchildren, all 10 of them, and family members. We really enjoyed a wonderful Easter, and I do hope each and every one of you enjoyed Easter and Passover, and a wonderful week of health and happiness. And look forward to next week, 12:30 Monday, with another presentation, live video. Oh, by the way, if you have something that you'd like for me to cover, please feel free to send the information in. I'll do everything I can to cover the subject as thoroughly as I possibly can for you. Thank you very, very much for all your questions and also for your responses. And I look forward to seeing you next Monday at 12:30. Bye-bye now.